Ready?
Yeah.
He's gonna bust that when you're dead. Where's his start?
My name's Tyler Schlenbaker, and I did my project on Parkinson's disease. So what is Parkinson's disease? It's an incurable neurological degenerative disorder of the central nervous system. There are more than 1 million Americans living with Parkinson's disease and approximately 7 to 10 million worldwide. 60,000 Americans are diagnosed each year. It's usually characterized by rigid muscles, slow movements, and tremors. It usually begins around the ages 50 to 65. So let's get a better understanding of what Parkinson's disease is. It affects more men than women. The disease is more common in developed countries. Studies find greater risk for people in rural areas and certain professions. The life expectancy is still around the same age as a person without Parkinson's disease. It was originally described by James Parkinson in 1817, where he wrote a paper called Shaking Palsy, where he detailed the signs and symptoms. Some of the symptoms are, like I described, tremors in the arms, legs, jaw, or head, rigidity, stiffness of the limbs and trunk, slow movements, and postural instability. There are 5 stages which were described by Hone and Yar of Parkinson's disease. In the first stage, the patient experiences mild symptoms, difficulty performing daily tasks which they otherwise complete with ease. There are changes in facial expressions, balance, and posture. In the second stage, affects both sides of the body, trouble maintaining balance or walking, and the tasks become harder to complete. In the third stage, they're more obvious with slower movements, more of a challenge for the person to stand or walk straight. In the fourth stage, the symptoms are more severe. It'll be difficult completing daily tasks. They may need the help of somebody else. There's increased muscle rigidity and slower movements, also known as bradykinesia. In the fifth stage, the person may not be able to take care of themselves, may need the help of somebody else or nursing care. They may lose the ability for physical movements and difficulty to stand or walk. So how does Parkinson's disease occur? There's no actual cause to Parkinson's disease. It occurs when the neurons in the brain deteriorate, which leads to decrease in a chemical called dopamine. Dopamine is responsible for transmitting messages that produce smooth, balanced bodily movements. In Parkinson's disease, the person lacks dopamine, which results in poor nerve functioning and loss of ability to control movements. There's no reason why these neurons become affected and impaired. There's no current way to diagnose a person with Parkinson's disease. The doctors will do MRIs, brain scans, CT scans just to rule out any other disorders. And then the physician may collect medical history and perform neurological examinations and then make a conclusion from there. After being diagnosed with Parkinson's disease, it's important to begin early treatments. Some of these treatments are medications. Levodopa, which is the most common drug used. It's a building block that converts dopamine and nerve cells to use to dopamine and to increase the brain supply. It's helpful in decreasing tremors and motor symptoms in early stages. There's also pallidotomy. It's a surgery that destroys the pallidus, which slows down the process to the thalamus to reduce tremors, rigidity, and the bradykinesia. And then a thalamotomy, the surgery destroys part of the thalamus that produces the tremors. Another type of treatment for Parkinson's disease is deep brain stimulation. This surgery requires a physician to place an electrical implant in the brain that controls signals to help reduce tremors and stiffness. The treatment is comparable to a pacemaker of the heart. It is also an advantage compared to other surgeries because the electrical device can be turned off. Research was also done from a 10-year study that compared the deep brain stimulation to drugs and found that their symptoms were improved by 1/3 less medication compared to others that did not have the surgery. There are many other ways to treat Parkinson's disease without use of surgeries or medication. Therapy can be helpful in improving a patient's function and quality of life. They can work on performing tasks such as just getting out of bed, walking up steps, and balance activities. There are 3 types of therapy: occupational therapy, physical therapy, and speech therapy. Under occupational therapy, the therapist's goal is to maintain as independent as possible, to just work on daily tasks and help with less assistance from caregivers. In physical therapy, They'll work on techniques such as movements, strength training, work on their posture, and they'll focus on the patient's gait. In speech therapy, they'll work on speech, communication, and also social conversation and swallowing. Combining all of these therapies can help maintain a quality of life and allow for independence for everyday tasks. Exercise is important with Parkinson's disease. Inactivity can be a factor in speeding up the process of Parkinson's disease, so it is important to stay active and incorporate an exercise regimen before and after the onset symptoms. There have been studies that focus on appropriate exercises to limit the negative effects on Parkinson's disease. People with Parkinson's disease begin to lose flexibility in the body. They may develop tight hip flexors, hamstrings, which lead to flexed posture and poor balance. Margaret Shankman developed a program called Axial Mobility Exercise. They focused on smaller movements and axial movement stretches to increase flexibility, breathing techniques, and range of motion exercises for the trunk and neck to improve the flexibility. In a research article, the effects of physical exercise, movement strategies, programmability, falls, and quality of life. They did a follow-up on 15 patients suffering from Parkinson's disease who attended 90 minutes of rehabilitation sessions on exercise therapy, and there were significant improvements in their Tenetti scores, which is a balance score, and that they had less falls. It is also important to maintain strength. So it's been shown people with Parkinson's disease lose muscular strength due to loss of stimulus of motor neurons. They'll lose strength in the extensor muscles, the hip and trunk, which I said these muscles are important for maintaining upright posture. So many of these patients have forward flex posture, which gradually gets worse. So it is important to exercise at least two to three times a week. Aerobic conditioning such as treadmill, water aerobics, and walking training are important. One of the most devastating impairments with Parkinson's disease is loss of balance and falls. About 66% of people fall, with 46 having recurrent falls. Some of these factors such as freezing, poor gait, muscular weakness, and balance issues were all causes for falls. There are also other interventions to help improve balance. Some of the newer ones are Tai Chi, yoga, and even the Nintendo Wii. And then there's multiple foundations that have been dedicated to finding a cure for Parkinson's disease. There's the National Institute of the Neurological Disorders and Stroke. They have programs now that collaborate with the Michael J. Fox Foundation, where they recruit volunteers, where they track the progression of the disease. Even the Morris K. Udall Centers of Excellence for Parkinson's Disease Research Program. This is established to find causes, improve treatment, and diagnosis. There's been multiple clinical studies that have been set up, such as deep brain stimulation, dyskinesia exercises, looking into the genetics, mitochondria studies, nerve growth factors, stem cells, and they continue to look for volunteers for these funded clinical studies to get a better understanding of Parkinson's disease. So overall, Parkinson's disease continues to affect millions of people worldwide. It begins by decreased dopamine levels in the brain and diminished neurons. And some believe that the environment plays a role or that it's hereditary, but it's still unknown. There are now many options that were once not available for Parkinson's disease. Only one day hope find a cure. So that is my speech on Parkinson's disease. I had my 3 volunteers, 2 up front, and the cameraman. So thanks.
I didn't even record.
Yeah, right. I'm starting to get tired. I lose my thought.